Hello, and welcome to a brief discussion on pathology of the cervical, thoracic, and lumbar spines. We are going to begin our discussion with kyphosis. Kyphosis is an abnormal or exaggerated convex curvature of the thoracic spine that often results in a stooped or hunched posture and can reduce the overall height of the patient. Kyphosis can be caused by a number of things, but most often we see kyphosis in osteoporotic patients, particularly postmenopausal women. And what happens is they get little compression fractures in the anterior edges of their vertebral bodies. And remember, osteoporosis is caused by a lack of bone density. So lack of bone density causes these little compression fractures to develop in the anterior vertebral bodies, which causes kind of this hunched or stooped posture. Kyphosis could be caused by poor posture or rickets or other diseases involving the spine. Do you remember what rickets is? Do you remember the term osteomalacia? Well, rickets or osteomalacia is a disease caused by a lack of bone hardening or density, secondary to a deficiency of calcium or vitamin D in the diet, or the body's inability to absorb those minerals. And rickets, remember, is more common in third world countries that don't have a lot of access to healthy foods or a lot of sunlight. Okay? A lateral projection of the T-spine would best demonstrate kyphosis. And you'll see kyphosis again in elderly women who have osteoporosis when you're doing a lateral chest x-ray. So you might hear techs say, well, the patient's very kyphotic. That means they have that exaggerated kind of hunched forward curvature. Okay, kyphosis involves the T-spine. Lordosis involves the L-spine. So remember, the term lordosis refers to the normal concave curvature of the lumbar spine. And you can see that here. When you look at a lumbar spine from the posterior aspect, you can see there's this concave curvature. Well, in a patient with lordosis, that can be used to describe an exaggerated or abnormal concave curvature of the lumbar spine. And again, a lateral projection, usually standing, would show this best. Okay, so kyphosis is T-spine, lordosis is L-spine. And then, of course, there's scoliosis. And scoliosis is an abnormal lateral curvature. So you can see the spine curves to the sides here, rather than forward or backward. Scoliosis is most common in children between the ages of 10 and 14 years and is more common in girls, but we really don't know why. Physicians use what's called a Cobb measurement, C-O-B-B, to determine the degree of curvature, and we use what's called a Scoli board, which is one long board used to image the entire spine at one time. It's really important to collimate when you're imaging patients with scoliosis, because think about it. They are going to have repeated follow-up imaging to kind of track the progress of their scoliosis. So they're going to have a lot of x-rays. And remember, these are typically younger patients. So really be careful with ALARA and use, increase your collimation with these patients. Treatment includes back braces and or surgery. Okay, next, let's talk about herniated nucleus pulposus. So the layman's term for this would be a slipped disc or a bulging disc, and you've probably heard of that before. What happens is the center of the intervertebral disc, the nucleus pulposus, kind of bulges through a tear in the outer fibrous ring, or the annulus fibrosus. So in other words, this outer portion of the intervertebral disc gets a tear, and the nucleus pulposus kind of pushes through, and it pushes on the spinal cord and the spinal nerves. That is what causes pain and symptoms such as radiculopathy, numbness and tingling in the extremities. This most often occurs at L4, L5, but certainly this can happen at any spinal level, and it can certainly happen in the C-spine as well. A herniated disc is usually due to age-related degeneration of the annulus fibrosus, or this outer ring, although trauma, lifting injuries, or straining can also cause a bulged disc. All right, next, do you remember ankylosing spondylitis? We just talked about this disease in the previous unit, the pelvis unit. So remember, in ankylosing spondylitis, there is inflammation around the joints in the spine. Remember, particularly this starts in the SI joints and then kind of works its way up the spine. And that inflammation causes the body to respond by creating new bone and fusing those joints together. So remember, we referred to this as bamboo spine. So this illness predominantly affects men between the ages of 20 and 40. Symptoms include pain and, of course, stiffness as a result of this inflammation and then new bone growth with fusing. Again, it can affect the SI joint, the intervertebral joints of the spine, or even the costovertebral joints. And remember, it ossifies those joints together so that there's less flexibility and movement. Okay. All right, next. Subluxations of the cervical spine. So the term subluxation means partial dislocation. And in the cervical spine, a subluxation is a disruption of the zygapophyseal joints, typically due to trauma. A patient may only have one zygapophyseal joint out of alignment, unilaterally, or a patient may have both right and left zygapophyseal joints disrupted, and that creates what we call bilateral locked joints or locked facets. Radiographically, this causes the vertebral body to appear over the vertebral body below it, and either way, this spine is not stable and this patient's experiencing pain. So you can see radiographically here is a subluxation of the Z joint, causing this vertebral body to kind of appear over the vertebral body below it. You can see that same thing here in this diagram. So what I need you to know is that subluxation means partial dislocation, and in the cervical spine, it affects those zygapophyseal joints. Okay? So here is an example of a subluxation. And can you tell which vertebral levels are involved? Well, if you said C5, C6, you are correct. So here's 1, 2, 3, 4, 5, and 6. And this is a pretty severe case. You can have milder versions of subluxation, certainly. All right, let's talk about some of the cervical spine fractures. The first fracture I want to talk about is the Clay-Shoveler's fracture. And this is a fracture to the spinous process of C6, C7, T1, so kind of that lower cervical region. In this case, C1, 2, 3, 4, 5, 6, 7. Here's C7, and notice the spinous process of C7 is fractured. This typically results from a hyperflexion of the neck, and again, it results in this avulsion type fracture of the spinous process. This pathology is best demonstrated in a lateral position. Okay, so Clay-Shoveler's is a fracture of the lower cervical spine spinous processes. Next is a hangman's fracture. A hangman's fracture is a fracture that extends through the pedicles of C2. And this cervical fracture occurs when the neck is subjected to extreme hyperextension. So the patient, if they survive this type of fracture, is not stable because the intact dens actually presses posteriorly against the brainstem. A lateral projection of the cervical spine will best demonstrate this anterior displacement of C2. And you can see that here. So here is the spinous process of C2. Here is the body of C2. It's been fractured at the pedicles. This type of fracture gets its name from the act of a person hanging, for example, in a noose, and the force of the patient dropping is supposed to be enough to fracture the neck and cause immediate death. Doesn't always work that way, but that was the intention. Okay, so we're going to pause part 1 here. We'll pick up with some more cervical spine fractures in part 2.